Hey, everybody, welcome to week 6. This week, you're going to be discussing and learning about anxiety disorders, trauma and crisis, as well as sleep and circadian rhythms. Let's go over anxiety disorders as a whole, because this is something that you are going to probably encounter the most as a nurse. So we're going to look at the effects of anxiety, and how they impair functioning, risk factors and proposed causes of anxiety, and risk for suicide for those with anxiety disorder. Also assessment and interventions that we need to do as nurses. So anxiety disorders are a group of conditions marked by two very core symptoms, and that is extreme fear and worry. And this is how it separates itself from depression. Those with anxiety experience disturbances of thinking, mood, behavior, physiological activity. Their fear and worry is difficult to control. Many will feel anxious most of the time with no apparent reason. The anxiety can be so uncomfortable that they stop doing certain everyday activities to avoid that feeling of dread. Some have terrifying bouts of intense anxiety, and it can actually immobilize them. And to relieve overwhelming feelings of anxiety, impending catastrophe, guilt, shame, helplessness, worthlessness, sufferers may cling to what we call maladaptive behaviors, which only actually makes their anxiety worse. So let's look at the anatomy of anxiety. From time to time, everyone experiences worry, apprehension, uncertainty, especially right before a test or any other important life event, job interviews, first dates. So mild or moderate anxiety rarely will threaten somebody's coping abilities. Actually, that kind of anxiety actually motivates us to try new things and to take risks. So in a sense, it's very useful and it's very productive. The degree of anxiety experienced and the ability to perceive it accurately and channel it appropriately determine if the anxiety will help the person or hinder the person's level of functioning. Someone who perceives anxiety as severe will feel threatened and either avoid it or will become overwhelmed by it. So let's look at prevalence. Anxiety disorders are the most common mental health disorder in the United States from childhood, adolescence, and adulthood. Globally, it's estimated there's about 3.6% of the population have some type of anxiety disorder. And that's only the ones that we've diagnosed. A lot of people suffer in silence. Women are twice as affected as men. And although the number of individuals officially diagnosed is high, it is suggested that the numbers of those who have undiagnosed anxiety are far higher. Treatment for anxiety disorder is readily available, in most cases very successful in restoring a productive and fulfilling life in those who have anxiety. So anxiety disorders are often accompanied by another psychiatric condition, especially mood disorders and substance abuse, as well as other medical disorders. Healthcare providers have to stay alert for this possibility, and many of the symptoms of anxiety disorders are very similar to the symptoms of major depression, which is why a lot of our treatments, namely pharmaceutical treatments like SSRIs, are so effective because they do handle both the anxiety and the depression piece. Anxiety disorders are thought to result from a combination of genetic, biochemical, neuroanatomic, and psychological factors. Of course, plus life experiences, because specific causes for each disorder will be discussed as we go into other disorders. So let's look at the myths. All anxiety disorders cause psychological symptoms, but only panic attacks cause physiological symptoms. In reality, both physiological and psychological symptoms accompany all levels of anxiety from mild to severe. So looking at genetics, research shows that some anxiety disorders are inherited. Many of them, including panic disorder, OCD, generalized anxiety disorder, and a lot of the phobias tend to run in families. And research continues to find genetic influences on inheritance and predisposition to anxiety. Researchers are looking at the gene factors that might explain or contribute to that inherited risk. And some studies are focusing on defective genes that regulate chemical messengers in the brain. If you remember when you took your chemistries and your biologies in high school and in college, or anatomy and physiology, there was these neurotransmitters, and they are responsible for a lot in psych. So they're very important. Neurotransmitters are very important entities to remember for test questions. They're called serotonin, dopamine, norepinephrine, glutamate, and GABA, which is gamma aminobutyric acid, but you'll just see it written as GABA. So those neurotransmitters are responsible for pretty much almost every psychological disorder. So we're looking at biochemical factors. So a lot of experts believe that people with anxiety disorders have this biological vulnerability to stress, which makes them more susceptible to environmental stimuli. So neurotransmitter imbalances will contribute to that anxiety disorder. And research suggests that the effects of neurotransmitters contributing to that complex phenomena of emotions are the basis for our everyday behaviors. And then neuroanatomic factors, looking at the brain structure, that's the limbic system, how it plays a role in regulating emotion. The most notable structures comprising the limbic system are your hippocampus. So that's your emotional memory, is your hippocampus. We have the hypothalamus. I'm drawing a blank today, it's Sunday. The hypothalamus, which organizes behaviors such as that fight or flight. And then we have your thalamus, which relays the sensory impulses to the cerebral cortex. And scientists are using what's called a functional MRI, and they're using positron emission tomography, or a PET scan, to look at the brain and the brain areas where these abnormalities are coming from and associating them with the anxiety responses. So there's a lot to learn, but we are slowly chugging along, and this is how new treatments and new medications emerge each day. So some theories suggest that certain anxiety disorders arise when the unconscious defense mechanisms become overwhelmed and dysfunctional. So interpersonal conflicts can cause anxiety. Family's role in phobias is also being researched. Several studies show a very strong correlation between a parent's fears and those of their children. In other words, the children learns fears by observing the parent's fearful reaction to a particular object. So there's a genetic component, and there's also a learned behavior. So if you have a parent who is extremely afraid of, spiders and snakes and whatever else, and then they teach their child to be afraid of these things, the child will start to grow up to have the same fears and phobias. We're looking at traumatic life events. There are traumatic events that can trigger anxiety disorders. The biggest one being post-traumatic stress disorder. That's another chapter. Panic disorders also have been associated with anxiety following separation and loss. Divorce, loss of a loved one, loss of a child. Some experts believe that someone who is vulnerable because of psychological, genetic, or biochemical factors will develop an anxiety disorder in response to that trauma. Some people may even have a biological propensity for specific phobias that is triggered by just one single exposure. So you look at the kid who maybe fell in a pool when they were 2 years old, and then they have this phobia or fear of water or swimming or any body of water, into their adulthood. And you could have somebody who may have been bitten by a snake who now has this complete phobia of anything in that realm, lizards, frogs, it can be triggered by a single exposure, and that is the PTSD piece. So when we assess patients for anxiety disorders, we have to keep in mind the differences among fear, anxiety, worry, and panic, because they are different. Fear is the response to an external stimuli. The emotional responses are regulated by connections between the different areas of the prefrontal cortex and other parts of the brain that you don't need to know about right now, because this is just an RN program. Anxiety is a response to an internal conflict. So fear, external, anxiety, internal, that influences behavior even after the cause of anxiety is removed. Worry is a maladaptive response to decrease anxiety triggered by events that are not within an individual's control, resulting in negative emotions and anxiety. It can include apprehensive expectations, catastrophic thinking, obsessive thoughts, and panic is an extreme level of anxiety characterized by sudden, overwhelming feelings of impending doom. Now, some anxiety symptoms are associated with medical conditions. Biggest one is thyroid dysfunction. So in psych, we test everyone's thyroid all the time, because the slightest imbalance of a thyroid can cause anxiety and depression, especially hyperthyroid. Another one is adrenal disorder. If your adrenal glands are putting out too much cortisol, that fight or flight anxiety feeling is constantly going to be there. We can also have withdrawal of medications. Alcohol being a big one can cause anxiety. Many health conditions, hormone imbalances, diabetes, asthma, digestive disorders, vertigo, sleep apnea, heart disease, all of these can lead to feelings of anxiety having a medical cause. So it's important to distinguish the symptoms of anxiety as they relate to an underlying medical problem versus symptoms of anxiety that relate to an actual anxiety disorder. Anxiety disorders are diagnosed when the symptoms are persistent and excessive. So remember, your risk factors are female gender and any kind of comorbidity like depression or other psychiatric disorders, because they tend to go hand in hand. Okay, so that was my little spiel on anxiety disorders. I hope you guys learned a little bit more and that it will help you when you are preparing for your NCLEX questions. And you guys have a great rest of your week.